I can do it.
These are the importance of cilia questions answered. What could be a reason that a woman would experience shoulder pain as a result of an ectopic pregnancy? There is no defined cause of the shoulder pain during an ectopic pregnancy, but the symptoms of this type of disease depends on where the blood is pooling and which nerves are being irritated. This shoulder pain is normally felt in the tip when laying down, and it is a very, very big sign of internal bleeding, so it's very important that women who think that they might be going through an ectopic pregnancy are aware of. Are there any other causes that result in an ectopic pregnancy, or is it just due to the damaged cilia? So yes, like I talked about in my presentation, a main cause of an ectopic pregnancy is damaged cilia, but there is also something called endometriosis, where the tissue of the uterus is outside of the uterus, and this causes scar tissue to develop in the fallopian tubes, in and around the fallopian tubes. And like I talked about in my presentation, when there is damaged cilia, the ovum is not able to move at a correct speed. But when there is a blockage in the fallopian tube, it works the same. The ovum is not able to travel this time actually at all because of the blockage of scar tissue. Are ectopic pregnancies able to resolve themselves, or is there any other way this pregnancy could reach full term? No, this pregnancy cannot reach full term when it is a tubal or abdominal pelvic pregnancy. It is nearly impossible. And if it's not taken care of in a timely manner, then it is also fatal to the mother. So even though it might be hard, it is very important that you go get that ectopic pregnancy removed through a salpingectomy. Does nicotine directly affect the cilia found in the fallopian tube, or is there a step between those two? Nicotine directly affects the cilia found everywhere in our body. Nicotine strictly decreases the numbers and decreases the structure, because the cilia become very brittle and hair-like, like I said, comparing it to brittle hair in real life. What causes the increase in ciliary beat frequency during ovulation? Is it endocrine signaling or nervous system stimulation? Another student asked a similar question, so I'm going to combine the two. I'll ask the next question next. What causes ciliary beat frequency to increase during ovulation? Does it have to do with hormonal changes? So combining these two questions, yes, the increase in ciliary beat frequency is due to hormonal or endocrine changes. Basically, ciliary beat frequency is changed or increases after the secretory phase of the ovarian cycle. During the secretory phase, follicular fluid is released into the peritoneal cavity, which then is released into the fallopian tubes. And this release of follicular fluid, which is hormonal, is said to be the reason why ciliary beat frequency is increased right after ovulation. Are there any diseases or viruses that can have a direct effect on cilia? If so, what are they? So the diseases and viruses don't necessarily have a direct effect on cilia. The effect of cilia that I talked about, or effect on cilia that I talked about, was nicotine. That is what affects the cilia. But there are a few diseases and infections that can cause or lead to diseases. So there's a lot of diseases that are classified by abnormal cilia, and a couple of them are primary ciliary dyskinesia, which is abnormal cilia. The classifications of those are basically chronic respiratory tract infections and the inability to have children, both having to do with how cilia is not working properly. The next one could be a sexually transmitted infection. In that case, cilia is also damaged due to that infection. And yeah. Is cilia damage from smoking permanent? Is a woman with ciliary dysfunction due to smoking able to repair it? So the answer is no to this one. Cilia is not permanently damaged from smoking. Depending on how bad or how long the smoking has been going on, it takes about 1 to 9 months for cilia to regenerate itself. And answering the second question, is a woman able to repair their own cilia? The answer is clinically no, but like I said, the body in time will regenerate cilia from about 1 to 9 months. Thank you.